Do you ever have so many questions and no one to ask, so they're just wasting away on Google searches you'll forget about in an hour or so?
We had that same problem, and that's why we created the RD2Be podcast, a resource for dietetic and nutrition students looking for answers that their peers don't have.
We are students Macy and Emily and registered dietitian Carl Barnes. We engage in conversations and learn from RDs.
Join us weekly as we gain insight into the unique journeys of registered dietitians all over the country.
All right, today our guest is Christina Morales. She's a registered dietitian, currently working at Walter Reed National Military Medical Center. We're happy to have her here. She is the chief of patient feeding operations, so basically running the kitchen side of patient feeding. She can give you a lot more about that. She has quite a bit of experience in various settings with some past history in long-term care, and then she can go into some other stuff. But welcome, Christina. I'll leave it to you and Macy.
Thanks, Carl. So first, I wanted to start off by getting to know you a little bit. So when did you first realize you wanted to become a registered dietitian? And was that first decision definitive? How definitive was it?
So I never actually knew I wanted to become a dietitian until I was in the midst of choosing programs to transfer to from community college. So I was initially a nursing major because right out of high school, I wasn't really sure what I wanted to be, but I knew I wanted to be in the medical field because I always liked science. And during my first years in community college, I became very interested in eating healthy, exercising and leading a healthy lifestyle. And in high school, I was never like a sports person or ever really exercised. I was like in band and student government. But in college is kind of like when I found that interest. And so when it came down to actually choosing programs to transfer to in community college, I looked at a lot of several programs that had the same prerequisites as nursing, and I didn't know that being a registered dietitian was actually something you could do as your career. And as I researched more, it was something more that I wanted to do. So that's kind of when I realized I wanted to become a registered dietitian, just finding that new interest in community college and knowing that that was a career opportunity. So when it came down to it, I just chose a lot of nutrition programs, actually all nutrition programs when I was transferring. So yeah.
Okay, so during that whole process, did you have any doubts, like during the midst of everything, when you were studying the nutrition classes?
So I actually never took a nutrition class. I guess I took one my last semester in community college after the fact that I've already transferred it. After I've already applied to transfer to nutrition programs, but no, I never really hesitated. Otherwise, I think I hesitated a lot as a nursing major because I didn't really think that was what I wanted to do. But when I started applying to nutrition programs, I never really doubted it. I was actually really excited about it.
Okay, so now reflecting on the whole process, what did you do as a student that made you the most prepared for your dietetic internship?
So, as a student in San Diego State University, I really immersed myself with a lot of extracurricular activities just because in my first year there, after transferring, I didn't really realize how competitive it is to become a registered dietitian. You know, when looking into the programs, I didn't really realize you have to apply to an internship and then go through that entire process and then sit for a board exam. So I never really knew about that until I actually got into my first year at San Diego State. So I then immersed myself with a lot of extracurricular activities to help my resume um, stand out from other applicants. So those activities included internship and volunteer programs for nonprofit organizations like Feeding America San Diego, American Heart Association. I also did an internship at Jack in the Box in their food safety lab. And then also I did volunteer at a hospital at St. Jude Medical Center while I was in community college. So that was something that I think prepared me for the various settings in basically being a dietitian and where they work, because it was community, hospital, and also uh, not necessarily food service, but I guess I did also work in a restaurant, and I worked at the dining hall at San Diego State. So I was kind of always in food service in a way. But I think the biggest thing that has probably helped prepare me for my dietetic internship was my involvement in leadership roles and the student organizations on campus. That definitely prepared me most for my internship because it forced me to, one, socialize with other people that were also in the same boat, and also become comfortable with networking and also public speaking. Because aside from just being involved in the student organizations, my first year I did, um, go for leadership positions and roles within the organizations, and also the um, associated students, which is kind of like the A is B, I guess, the student government at San Diego State. And I think that really, one, kind of enhanced my passion for leadership, and as well as just being comfortable with speaking. And I think that was like a really big thing that helped prepare me for my internship, and even just now as just as a professional.
Okay, so how does public speaking benefit? How did it benefit you? Like, in what specific ways did it benefit you?
So public speaking, I think, helped me specifically in really, one, with public speaking, you had, I think, for me, you have to prepare for it. So like just really gathering your thoughts and knowing, what you want to convey to whoever you're speaking to. And also I think that also, just confidence in general too, because public speaking isn't really something that a lot of people are comfortable with. But I feel like, when you're passionate and really know what you're speaking about, like public speaking is kind of like a test to like your confidence in that. And that also didn't really, it also, I think, helped encourage me to just, um, I don't know, like I said, just be more confident in a lot of the things, uh, within the profession.
Do you
And
find
even
that? Oh,
now,
sorry.
I guess even now too, just as a leader, and having to always hold meetings and just speaking with people, and also as a dietitian, you're part of the interdisciplinary team, and having to be comfortable in those discussions regarding patient care or anything, in your profession, just speaking and like being comfortable in a group, not necessarily like a huge audience, but even in a group. I think that also helped me, when I became a dietitian, just being, um, comfortable in that setting.
Okay, so you think that you were probably more credible, like to the interdisciplinary team? You think that you seemed more credible versus if you weren't as confident?
Yeah, yeah, because I think, when you're speaking like in regards to like patient care and you probably don't sound pretty confident, then not sure if, um, other people will take you, I guess, seriously in what you say. Seriously, if like you're not feeling confident in your recommendations, for like patient care.
Okay. So to contrast that, what kind of knowledge, skills, or experience do you wish you gained before becoming a registered dietitian?
So this question is kind of hard. um, but I guess just being in the profession now, I know a lot of the my classmates had to take accounting classes and stuff, but I never did. I took more of the science courses because I think accounting became one of the requirements after I've already transferred. So like anything with accounting, budgeting, and financial, like knowledge and experience and skills is probably something that I would have liked to gain before becoming a registered dietitian, because I find myself just trying to like learn that now as I'm in the position to kind of review or go over that. So I think that's part of one of the things that I wish that I had gained before becoming a registered dietitian.
Okay. Is that like a common issue with other registered dietitians as well?
I'm not really sure. Probably those in management for sure, because as a clinical dietitian, you don't really have to um, know a lot about budgeting or any like financial stuff with like contracts and all that stuff. I think it's more food service management probably.
Okay. So now that you've been a registered dietitian for some time, what have been the most rewarding experiences? And then you can also add on what have been the most challenging experiences.
What was the second question? I'm sorry.
And what have been the most challenging experiences?
Okay. The most rewarding experience is, of course, knowing I'm making a difference and an impact on people's lives. So, one particular example I guess I could give is I'll never forget when I worked as a clinical dietitian at a long term care facility and having identified an issue with patient care. And basically, I just identified that, a patient was bed bound and immobile or whatever, and not really the quality of care has declined. And obviously, in nutrition, like the patient also seemed malnourished and everything like that. And I think being vocal about how we can better improve that care and service we provided for that particular patient. And this comes back to being confident and comfortable in communicating and collaborating with other interdisciplinary team members. I think my initiative in identifying that and then also making sure I communicate it to other interdisciplinary team members like the social worker, the administrator, the nursing, and how we can better improve that patient care service we're providing, after just being vocal about that and even collaborating with the family members and all that and having our like IDT meeting, after that, and just knowing and changing the interventions and all of that, I saw a significant increase in the patient's quality of life to the point where, she was up and, talking and eating eventually. And I think like that is kind of like a rewarding, that's one of my notable rewarding experience I've had since a clinical dietitian, just knowing that I could make a difference. And it goes back to being confident in knowing what is right for the patient and not being afraid to challenge, right, the nurses or the social worker who you think have identified that or have the, not saying they don't have the patient's best interest in mind, but just being part of that IDT team and also being vocal and confident in addressing that and challenging them, because sometimes they may not agree, but just again, just holding your own and being confident in communicating that. I think that's probably the most rewarding. And she was also one of my favorite patients.
Oh,
um, so I'll never forget that.
so before you speak about your challenges, I would just want to ask, how did you gain that confidence? Was it mainly from your education or more about experience? Like, how long did it take for you to build up that confidence fully?
I think I think a lot that confidence comes from, so just to go back, as an intern, my I thought that my weakness even completing my internship was clinical. I didn't think that that was my strength. And so part of the reason why I wanted to become a clinical dietitian was so that I can be better at clinical. Um and so, as a new dietitian, I was definitely not super confident knowing that I didn't feel um, that that was my strength. So I think just being willing to be mentored and like work with the nursing staff that I worked with at my first job. I think part of that too is just I was able to create and build relationships with nursing and other interdisciplinary team members. And I learned a lot during my first year with them. And just basically, they helped me a lot in really knowing how to better care for the patient, because we would always have like team meetings and just obviously through experience, but also being willing to be mentored and still constantly learning. And also just creating and building those relationships. And I think I don't know. I think that's how it's been, because I think in any setting that I've worked in now, so I've worked in like probably 4 or 5 different long-term care facilities where I've had to meet different IDT members and director of nursing and things like that. And I think just from my first year as a clinical dietitian and knowing how important creating and building those relationships are, and then that also lets them trust you a little bit too, and really sees you as the profession, in nutrition and dietetics. And I think that just kind of like where that came from. I don't know if that answered your question.
No, yeah, it did. Now, so what was the most challenging experiences that you've had?
So the most challenging experience I've had is in my current position at being in management, and basically the difficulties that come with working with various different people and different personalities, and just knowing that you can never really satisfy everyone. But being firm in your beliefs that you are doing the right thing, I think, is what helps the challenge that I have every single day. So yeah, I think it's just management. I think is just very difficult in general, because you're working with a lot of different personalities and different groups of people and different beliefs and all of that stuff. But um yeah, so every day is a challenge, which I like.
How did it go when you first started off as a manager or in management? Like, how did you grow? How have you grown since you first started, at least?
That's a good question. So I actually just hit my 1 year as being in the role that I'm in right now, and I can definitely say that I have significantly um, changed and grown from the experience. It was definitely very difficult at first, because a lot of my staff have worked there for a very long time. So, a new manager um, is a little bit, I don't know. I don't think they were really accepting of a new manager a little bit. And obviously, they didn't trust me, they didn't know me. So, and there were a lot of historical background of personnel issues and stuff like that in the past. So, and a lot of things have just stayed the same, and they're not very willing to accept change. However, as I like assumed my role, there were a lot of things that I identified that were areas for improvement and changes that needed to be made. Specifically, one thing that I identified was really the morale of the work environment was one thing, and so it was really difficult for me to find out what the best way is to help that, and also gain the trust and respect from my supervisors and staff. um, but I think just having those interpersonal skills, I think, is very important, and really always remembering that what everything that I wanted to do, or the changes that I wanted to make, was not only for myself or for anything, but always to help improve the organization and the mission. And again, just building those relationships with my supervisors was really important, and then showing them that I am there to support them, and not necessarily be there to make their, I don't know, work life not so great. And also, I think a lot of it too is setting expectations and keeping people accountable was the biggest thing that I think helped me gain their respect. Um, because everything that I did always had to go back to their expectations, and I never asked them for anything outside of that. And also just yeah, I think that's it. I'll go through more stuff later. regarding my job. I could talk all day about it.
But just as quick note, did you have any training like from being a specific manager before? Or is it just based off experience that you were credible for the job?
So in a long-term care setting, because that's where I was for the first 3 years as a dietitian. Um, it's definitely mainly based like clinical based. However, as a dietitian in that setting, you're still kind of seen as one of the leaders, right? But in your role as a dietitian, but I never had to manage people exactly. I was kind of seen as a professional, as a leader, but never had real experience managing people, if that makes sense. I did in-service trainings and stuff for the kitchen staff, but I never managed them.
Okay.
So I didn't actually have experience in it. However, I like to think that I'm just a natural born leader. I'm just kidding.
Yeah, I mean,
No, but I think just a culmination of a lot of my experiences in one being a leader on campus in the student organization, and really that kind of probably opened my passion for helping inspire people and also helping motivate people as well. That's probably like my where like some sort of management experience, I guess, but not necessarily obviously like the scheduling, the all that part, staffing and all that stuff, but more of the leading part. I think I've had experience in, but not necessarily like the actual management part, and all of that I just like learned as I assumed the role.
okay. So you seem like a very positive person, but during your dietetic journey, were you ever dissatisfied? And if so, what did you do about it?
So, like you said, I normally try to be very positive. So I don't think I ever felt dissatisfied, but I think after being a clinical dietitian, like I mentioned, for 3 years, I felt very comfortable and felt like I wasn't being challenged anymore. And so I wanted to do more. So I was not necessarily dissatisfied because, you know, I liked going to work every day and like the people that I worked with, I really enjoyed, but I just got too comfortable. And again, I just wasn't being challenged anymore. So I was very fortunate enough to have this opportunity to take this position, and I've always known I wanted to be in a management or leadership role. So I was very fortunate and lucky to have had this opportunity to basically apply for the current position that I'm in. And so I picked up all my stuff and moved across country for it.
That's awesome. I don't know if I missed this, but how did you find this opportunity? Did you mention?
Through networking.
Okay.
Yeah.
Okay. That's awesome. So the importance of networking is pretty great.
Yeah, for sure. Especially the classmates that you have um in college. Well, actually all my best friends are all dietitians because we all went to college together. And so yeah, but networking and just kind of keeping those the close contacts that you make, you know, in your undergrad through your internship. You know, I know so many dietitians now just through all my experiences since a student until now.
Okay. So was it all just people that were close to you, or did you ever try to branch out and find actual people to network with, or is it just simple like that?
So I feel like the dietitian world is like relatively small.
Mm.
So obviously, you know, my networking started with just the people I went to school with, but then as they branched out and as they also networked, and so did I as a professional, then we just kind of all, I don't know, we just kind of like all bring each other together in a
Yeah.
way. And also just being a dietitian, I've trained multiple dietitians too, and I've also precepted interns who are now dietitians. So even in that way, like we just continue to network, you know.
Yeah. Okay. Thank you. So at your current job, what do some of your daily or weekly or monthly goals look like?
So my job is different every single day, but
Yeah.
obviously there's always goals that I need to accomplish. My daily goal, I guess, because every day is different, but my daily goal is always to make sure I communicate effectively to my staff and ensure that they know I am there to support them. That's daily. It's my goal. Um, Weekly obviously just depends on the tasks that need to be completed at hand, but obviously always ensuring the efficiency of the operation and to make sure we're continuing to provide excellent patient care. That's every day also. And then like weekly I always have meetings and reports, stuff to update, all that stuff. And then monthly is kind of the same, just a lot of like making sure your projects are done and completed. And I don't know, that's kind of a hard question because
Yeah.
every day is different. So I don't really, and every month is even different too. There's different like goals. But I guess one example would be like, for example, this month, um, my weekly goal this month up until Thanksgiving is to make sure that we're prepared for our Thanksgiving menu, and everything that we're doing for Thanksgiving. So that's like an example for this month. Um, and then my monthly goal this month is to make sure all of that is completed and also to complete the new winter menu design that we have. So that's a little bit different this month that we have. So it's different every single month and even every week because it just you never know what happens.
Okay, so who's on your team of making these like Thanksgiving menus and all that? How many people do you think collaborate on that?
So I have so overall I have about like 60 employees that I supervise, but then aside from within those 60 employees are several different supervisors. And so I guess to help me, my team that helps me with those specific projects would be like probably like 6 people. And they're all like the supervisors directly like report to me. So they kind of like help me with those initiating those project and also helping communicate to the rest of the staff on how to execute it too.
Okay, so who do you like you're the manager of supervisors, correct?
Mm-hmm.
So who do you respond to? Like who's your higher up?
I report to. Um, so I report to the chief of clinical division. So her position is basically she oversees inpatient nutrition, outpatient nutrition, and then patient room service where I fall under. So she basically oversees all three of those operations. And then the second person, which is her boss, which is also my boss, is the director of the nutrition department.
Okay. How often is she in? Like, do you see her every day or
Um,
like a couple times a week?
so I talk to her every single day. She's actually currently teleworking right now.
Okay.
So I don't necessarily see her every day, but
Mhm.
I talk to her every single day.
Okay.
And if she was there, I would see her every day because her office is next to mine. Because we just communicate a lot every day, especially now that she's teleworking.
Okay. So, with all your goals at work, how do you maintain a work-life balance?
So this is a hard question to answer because I
Yeah.
like to think I'm just very good at this. Just kidding.
Yeah.
But I don't actually have a particular strategy. I just think I'm very good at time management and making sure I just make time overall to clear my head and to focus on myself, my health, exercising, and now making time for my puppy.
Mm.
And also even just being across the country, ensuring I continue to keep in touch with my family and friends back home. And for some reason, I also try to make time to date too. So I just think I am able to just balance that just through prioritizing and time management. And I think I've always been the type of person that needs to be doing multiple things and keeping myself busy. I'm also in grad school. um, So it's definitely been a challenge to try to balance everything out. But so far I've been able to successfully just kind of go through the motions and not necessarily fail in anything so far. And hopefully I don't. But
That's
yeah,
awesome.
I think it's just prioritizing and just good time management. And I get like 6 hours of sleep. I know I'm supposed to get 8,
Oh
but I just
gosh. You should
yeah.
just add another hour onto that, make it 7. But
I
you
still
mentioned
have all this energy, so
you could have more though. But
yeah.
you mentioned you were in grad school, so what are you studying in grad school right now?
I did my internship through Utah State University, and they also offer a master's. It's called Master's in Dietetic Administration, which has an emphasis on management and leadership, so directly related to what I'm doing. So that's currently what I'm going for my master's.
Okay. So as a registered dietitian, what have you become the most passionate about?
I think I've become really passionate about inspiring others and making a difference in their lives and their perspectives. I know, very probably cliche, but that's really, I think, what I've become very passionate about, and just providing a purpose for people and changing their mindset to be a positive one. And I think I've really found that in my current role, and just also seeing kind of just the way I interact and communicate to people and the changes that I've tried to implement and have them believe in that too. I think seeing that has been just really rewarding. And so I think I'm just really overall passionate about just inspiring other people and to just kind of change their mindset to be a positive one and not necessarily just a blah negative one.
Do you want to inspire other dietitians? Do you ever see a dietitian just want to improve their attitude ever, or are they all just pretty positive like you?
No, they're definitely not. Um, so I don't know. Actually, I've never really thought about like inspiring other dietitians. But I know, I think I've definitely tried to inspire interns that that I'm their preceptor. I think I start there with the students and the interns in regards to inspiring them. So hopefully that they can kind of have the same maybe perspective in the professions once they get into the profession. I don't necessarily know if, I mean, it would be rewarding to inspire anyone really,
Yeah,
but to I think it'll be a little bit more difficult to try to change people's mindset who have been in the profession and have their own set of opinions already as dietitians already. So just, inspiring others that are, one, willing to learn and continue to grow and changing their perspectives. And I really enjoy doing that for students and interns mainly.
that's awesome. So where do you see yourself in 10 years?
So for someone that likes to plan everything out, I honestly haven't thought about where I see myself in 10 years. I just know where I am in life. I want to make sure that I'm doing something that I love and surrounded with people who are motivated, and if not, to continue to, and if not, my goal is to continue to inspire others to be motivated, if that makes sense. So I don't necessarily know what setting I want to be in or where I see myself exactly, but just knowing that, one, again, I'm making a difference, and that I'm doing something that I love and surrounded with, people that are also motivated in what they do. And yeah, probably, hopefully still in management. I don't know, we'll see.
Oh yeah, do you want to grow from management? Do you want to get to a higher position in management?
Yeah, I think after, I mean, my job right now is still, constantly challenging, but I think probably overall I'd probably would like to, manage an entire nutrition department or something one day, maybe. I don't know.
So my last question is, as a student, how did you plan or navigate your journey?
Um
You did.
so well, I'm a huge planner in general. So, um, once somebody tells me what I need to do, I plan it out. So, like I said, as an undergrad, I was told, all right, well, you should have good grades, right? Second, make sure that your resume is shows that you have experience in X, Y, and Z areas or whatever. So as a student, I was just like, I took that and was like, all right, what do I need to do? I joined the student nutrition organizations. I Googled um, places I can volunteer, nonprofit organizations that I could possibly intern at, and one of them actually was Feeding America San Diego. And they were testing out like a pilot program for this like nutrition advocate program, and I was able to start and help with that, creating lesson plans and all those things too. So just looking in the community and how I can help them, because technically, as a student, everything is like free help, and most people are like willing to take that on, and I was willing to do whatever it took. And so basically having that initiative and doing your research and being willing to basically, do what you can for the community. And also, again, networking is really important. And I think the biggest thing that I would like to probably even say in general to all students is to not look at your classmates as people you need to compete with, because I think a lot of people do that. And I think the greatest thing that my close friends and I have done was not be part of that, and really just actually thrive off of each other, and really just worked with each other to even better um, ourselves and our resumes at the time as students. And because whatever that person has, you're willing to share it, I think was important too. And also it just makes the whole application process and just your life as a student better when you have somebody or people there with you that you're working through the same thing. I think that that was really important. It's just like a huge support system with a very stressful time, trying to you know get good grades, studying, and then just finding all these things that you need to be doing to make sure that your resume is good to get an internship. Yeah, so that just support and all that stuff is really important.
Okay, so I know I said that was my last question, but I have one more.
Yeah.
You mentioned that students are very kind of can be competitive. Do you ever see that as an RD still in your workplace?
No, I
No?
don't think so, because I think at this point, I think a lot of people are just kind of I don't know where they want to be, at least the people that I've worked with, where they want to be. Or I've obviously trained a lot of dietitians who are just starting off as a dietitian, and they're like, wherever I can get a job in the beginning, get that 1 year experience or whatever. I think a lot of people are just open-minded at this point, and probably take a lot of advice and stuff from current dietitians already. And I think what I have found with the dietitians that I've worked with and even trained, we're all kind of just very willing to help each other out at this point. So I think it's important to instill that in our students too, and not like be in that competitive mindset.
Okay, thank you for coming onto this podcast and sharing your experiences. I really appreciate it.
Thank you for having me.